Hey, do you wonder what it's like to be 27 weeks pregnant? Well, this video, I'll let you know what it's been like for me. Welcome to my 27-week bump date. If you don't know me, my name is Victoria. I'm a certified birth doula, and this is my channel for expecting parents as well as birth professionals. But during the pregnancy of my fourth child, I have turned it into a little bit of a personal update space. And so that's what this week is going to focus on. So physically, I would say I'm feeling good, not 100%, but pretty okay. Functional. We'll say functional. How's that? I have experienced a lot more pain in this pregnancy than my others. I think it's because there's been a bit of time since my last pregnancy. My youngest is 4 years old. And so I think that's contributing to it. I think my pace and lifestyle as a working full-time birth doula, getting up in the middle of the night, working funny hours, getting funny sleep, I think that contributes to it. And I don't know, I think through the pandemic, not only was the pandemic hard for a lot of people, us included, it was also just personally, there were just some tough things that kind of came out of the pandemic for us. And so I didn't cope as well through those, mainly by stress eating, which isn't good. So I started this pregnancy kind of with the most weight I've ever had on my body, but also just sort of habits that I'm not really proud of, like too much screen time, again, kind of comfort eating, not moving my body as much as I thought I would or wanted to. So I'm starting the pregnancy, I guess, at a different baseline. I think all of that has contributed to the physical discomfort that I'm experiencing. I have some carpal tunnel going on in my hands, just some achiness in my body, definitely by the end of the day. My legs are pretty sore. There's this one spot in my back I'm working on getting to feel better, but by the end of the day, right here in the middle of my back, it is pretty excruciating. And I'm just kind of, managing the best I can. Some care routines I do. I go to a craniosacral therapist every month. That's going to be bumping up to twice a month now that I'm knocking on the third trimester. I actually need to call today a chiropractor to start that up. I haven't done it so far, but I think it's time, especially with this back pain I've been having. I also am taking magnesium at night as a supplement, magnesium spray that I'm using, like on my achy muscles. I take Epsom salt baths regularly. I use a heating pad, just massage. Like I'll ask my husband Ben to massage the areas that are hurting. And that's pretty much been, I guess, handling the pain that I have. I wish the pain wasn't there at all, but I also acknowledge this is my fourth pregnancy. Again, it's been a while since I've been pregnant, and I didn't start this pregnancy at like the healthiest baseline that I would like to have, but I'm working on correcting the things that I can. As a doula, I think I really work with clients to help them just accept what's happening in the moment, and I definitely am doing some of that in pregnancy so far, the discomfort I'm having. Just accepting, hey, this is where I am. I can't change the past, but I can change how I move forward in the future. And so working on those sorts of things. I'm showing a lot more. People are coming up and like, oh, can I feel your baby? And they're going up high. And I want to say like, that's my COVID weight. That's not my baby. My baby's really low on my pelvis because it's our fourth time, right? That pelvic floor is just a nice, cozy hammock at this point. It's just kind of where these babies, my uterus is just sinking in there and getting really comfy. But having said that, I am feeling a lot of movement from her. If you didn't see her gender reveal video, I guess spoiler alert, it's a girl. We have 4 girls, and we're so thrilled about that. But I can definitely feel her moving more and more. I'm curious to see when I'll start feeling her higher. It's funny, like even though I work with pregnant people like on a daily basis, when it's your own pregnancy, you kind of forget like, oh yeah, when does that happen? Like, when do I feel more of her? Or does my belly get bigger and all of that kind of stuff? I definitely feel movement. She's definitely, like a lot of babies are pretty active at night. After I eat, definitely notice movement. And when things are still, like if I'm still, it's quiet, she'll move a lot in the quiet. So we'll see if that holds up when she's here. But that's been kind of fun to get to see her, even though it's still really low. Like I know she's growing bigger, my belly is growing, but it's just the baby is definitely low. I feel like all of my fat is up high. Mentally and emotionally, I would say, I've been struggling a little bit. I guess I'll just go ahead and say that, I'm trying to be open on these bump dates and just tell you how it is. But I was looking back at some journaling I did in my past pregnancies, and other than my first pregnancy, it's just kind of been like a mind melt for me, honestly. There's some personal experiences we had, not with us personally, but people we were close to, have had some tough birth experiences, tough outcomes. Obviously as a doula, I've seen difficult traumatic births. I've seen, really tragic outcomes. And so it's hard not to not let that stuff affect you. I guess post-secondary trauma, whatever you want to call that. But it started in my second pregnancy. And ever since then, it's just been this theme of like, I love being pregnant. I really, truly do. I feel her kick right now. Like, I love that feeling. I love getting to give birth. I love breastfeeding, and I love baby wearing and all the postpartum stuff you can do. Of course, things are hard as well, but I really do love it. But there's always this like cloud of anxiety, racing thoughts, just kind of, I have to slow myself down. Something I've been saying to myself, kind of like a mantra, I guess, or an affirmation would be, that was their birth. This is your birth. So when I walk into a client room, I try to say like, this is their experience. You'll have your own experience. Just trying to separate, like, just because I've seen it doesn't mean it's going to happen to me. As I've talked to like other nurses and midwives and doulas who've been pregnant after having worked in the field, they all have said something similar of like, it's just kind of hard to not get out of your head, what you've seen. I think some people can do it, but I'm just a person I'm typically prone to anxiety. I've been diagnosed with an anxiety disorder. I've been diagnosed with ADHD. So kind of that quick thinking, overactive thinking, all of that stuff. I have to do a lot to really simmer my mind down and focus it on more helpful, constructive things. I did go to therapy again in this pregnancy. My therapist kind of discharged me and said, we'll talk again postpartum. But basically it's just one of those things of realizing these thoughts, intrusive thoughts, the racing thoughts, when they happen, if I can handle it and not kind of get overwhelmed by it, it's just walking that road, I guess, of, okay, here's a unwanted thought again that I'm having. What do I need to do to, kind of bring myself back down to earth and just acknowledge that, especially with intrusive thoughts, my therapist this time around gave me some really helpful education of those aren't indicative of anything other than your mind made up some really messed up story that it's trying to tell you. It doesn't mean anything about you, your mental health. Of course, it doesn't mean that thing is going to happen. It just means, wow, you had a really crummy thought. And we can just let it go. You don't need to give any attention to it. So that's been helpful. But again, I think it's important to say, mentally and emotionally, pregnancy is hard for me. Birth plan, like part of the hardness is in our birth planning. We're doing something we've never done before, which is planning for a home birth. I'm both so excited about it, and also that's part of that sort of mental and emotional health piece. I even wrote on our birth plan, like, I'm struggling because I've had, I've seen traumatic births, especially at home before as a doula. I'm going to need some extra help and compassion in this area to remind me things are going well. I might want extra check-ins, that my health is good, my baby's health is good. But also I still really value the care and autonomy, and pace, and just a lot of those hallmarks of home birth care are really important to me. And we really went back and forth of, should we plan for a hospital birth again or try a home birth this time? And really what I want out of a home birth, is the care. I want the freedom to not have to be, having conversations with nurses or providers to get what I want. I want to be home. We have 3 other kids. I don't want to be in a hospital for an extended period of time. I want access to comfort tools that are more readily, available and accessible at home. And I value, so far, I'll say the prenatal care has been totally worth it, even if I end up risking out of a home birth before I even go into labor, which happens, or if we end up transporting in labor, which can also happen. Even if those things happen, I will still be so grateful for the prenatal care I've gotten and the postpartum care I know that I will get. So I'd say it's definitely been worth it. The investment of time and money and intention have still been totally worth it, because that care is what I need, you know, like I need a 45-minute or an hour long appointment right now to really talk through things, and kind of a safe place for that worst case scenario that can kind of play out in my mind to land. And I need that midwife reassurance to say, well, hey, here's our plan. Here's what we're going to do if the worst case happens, but also here's how healthy you are. Here's how your pregnancy is going. I'm not expecting that. And here are the red flags I'm looking for. I'm not seeing any of those. You know, it's just helpful to talk through. And I'm excited. Like, I am excited when I think about laboring at home and our kids being able to be there and the people I love being able to be there, welcoming this little girl. It's what I want, even if I'm facing some fear with it. Not really because of home birth, because I think I have lots of fear about hospital too still, you know. And it's funny, like I want to be honest with this update of, hey, I'm a doula. We are not immune, you know, from fear and anxiety, even though we help people overcome their fear and anxieties all the time. Again, I just, for me at least, it's really that, like, I've been to almost 100 births. I've seen some stuff go down at home and in the hospital. And I know it can happen in either setting. And there's a little bit of apprehension of like, oh gosh, I don't want that to happen to me or my baby. But also there's an assurance of knowing that I know my options. I know the plans that I can make. I know you know, that I can say what's important to us, to our family, and get that care, you know, that no matter where we are. So there's a comfort in that, even if there is sort of like a, oh, I don't really like thinking about what I've seen, you know, learning how to separate it. There still is a comfort in, hey, I know the options. I can make the decisions. And so that's been helpful. Again, like the other night, I kind of wrote out our birth plan. You know, I feel like I was finally ready to do that. And it was just good. It was good to see it on paper and like, okay, here's the best case scenario. Here's the worst case scenario. And you know, I'm ready for whatever happens. I'm ready to meet this little girl and feel confident in our team. You know, I feel confident in my husband and our doula, you know, and the providers we surrounded ourselves with. So I guess that's another update. You know, I've started to have some of that pregnancy insomnia again. I have an appointment for a gestational diabetes screening and our blood prenatal on Tuesday. And so I'm definitely going to talk to my midwife then of like, is there anything else I can be doing? I'll tell her what I've been doing to manage it. I'm trying to get back to sleep, but I think it's just part of it. You know, again, I think a lot of it is coming into this pregnancy, just not really where I wanted to be physically or mentally or emotionally or spiritually. But I know like where to go for the help, and I know help is available, and I know that we can do hard things and we can walk through the expected and the unexpected. And it's just making us stronger. So I'm grateful for that. Even if it's difficult, it still can be beautiful. So yeah, I think that's where I am. I'm trying to think of other things that might be relevant for this month date. Some people have said they want to hear more about our home birth preparation. I'll probably just do a whole video about what that looks like. For those of you who are wondering. And of course, you know, we'll have some sort of birth story when it happens. One thing with the home birth is that we are, like one thing I know I have, a condition I know I have is low blood platelets. It's just a chronic condition. It's genetic, you know, it's not necessarily like eat more iron and you'll have better blood. It's just a thing that's happening in my body, and platelets are a clotting factor. So, you know, obviously if your platelets are below a certain level, you wouldn't want to be in a home setting because you need access to blood transfusion should you bleed out too much. But also the flip side, the kicker is that you also can't get an epidural. And I've never used an epidural, but I'm kind of glad that was always my plan because I'm not eligible for one if my platelets go below a certain amount, because that can cause bleeding out in your spine. So that's one I'm a little, you know, like I'm really hoping the platelets stay up and we can just stay home. Because again, if I can't have an epidural, if something like a C-section were needed, it's always been the plan that I would just go under general because I'm not eligible for like a spinal or an epidural because of that clotting factor. Like there's too high of a risk of bleeding out in my spine. So even things like that, that's always been the case. You know, it's a little more top of mind now just because we're wanting a home birth. But to like that Tuesday appointment that's upcoming, we're going to get to take my full blood panel, see where the platelets are. I have been taking some supplements to try to boost them. So I'm really curious to see if that has helped at all. And there'll be time, you know, if they are going lower, there'll be time to start steroids or medications to see if we can boost them. But it's just, there's kind of a piece in that, I think, too. For me, planning a home birth, I really trust our team. And it's going to come down to the numbers. if I can stay home or not, like anybody who's planning out a hospital birth. Hopefully have a provider who's checking your health and making sure you're not risking out of home birth care, because it really is ideal for low risk people. So that's sort of a piece, I guess, of if it's not meant for me to be at home, we'll know in the numbers, and I'll go to the hospital and it will be okay. But I'll do a separate video more about home birth care. And my husband, I think he might come on and kind of talk too from his perspective. That'd be interesting. But we're excited. I'm still hopeful that we'll get to have this baby at home, because I think it's going to be wonderful just to get to be in our own space, have our own people there, have the emergency and kind of life-saving things available if we need it, but also just the freedom to do things on our own terms. So we're really hopeful for that. You can send us your thoughts and prayers. And otherwise, that's kind of our bump date. You'll notice I'm in my closet. That's because my office is closing due to this pregnancy and just a couple other business decisions. We thought it was best to slow that down. I'll still be working as a doula, and we even have some new doulas who joined the practice who are going to be kind of taking on inquiries and clients and that sort of thing, which I'm excited about. But with the baby, it just doesn't make sense to keep up a whole office space. So even in that transition, that was a little bittersweet. I'm grateful to have the space to make it. I'm grateful that my business can work around my life, I guess. And so that's different. It'll be nice though that she'll just be napping. That's our main bedroom, our master room across that door. So it'll be great just to have her close and work a little bit and snuggle a little bit once I'm back from maternity leave. The kiddos are really excited. This pregnancy has really felt like it's going slowly. I think because we have 3 little kids who, it's almost like they're always asking, is it Christmas yet? Is it Christmas yet? Is it Emma Joe's gonna come yet? And no, like we still have some time to wait. I think that's kind of making it feel like, oh gosh, for their sake, I just want her to be here. But I know it can go so fast too, so we're trying to soak up and enjoy being pregnant, and just soak it up, trying to be patient, knowing once she's here, it's going to feel like this time flew by. But it definitely has felt more just of a stretch for me to wait. But they're very excited. So can't wait to see your sisters, meet her, and just to see what our family is like as a family of 4. So that's our bump day. They might get more frequent now that we're kind of getting into the 3rd trimester and, more decisions are made, more information. You can kind of, things can start picking up it again, more appointments, that sort of thing. So I'll keep you guys updated, but thanks for watching this bump date, and hope you have a nice rest of your day. Bye.